Following the sudden death of actor Matthew Perry, caused by acute effects of ketamine, 5 people are now charged in his death and 2 are doctors.
Riley Nagel has more about the dangers of ketamine and how it is supposed to be used.
You know, Matthew Perry had resources, Matthew Perry had money, he even had somebody there injecting him, but the thing is, it wasn't a medical person. We exist to remove the risk so you can go through this process and get all the benefit and not have to carry all the risk.
Charles Miller is a certified registered nurse anesthetist and owns Scenic City Neurotherapy. They see patients for mental health and chronic pain conditions. Ketamine infusion therapy is one of their treatments.
We are able to stimulate areas of the brain that aren't communicating effectively or sending inappropriate connections.
Miller explained ketamine is a non-opioid, non-narcotic anesthetic. It's one of the safest anesthetics widely used in the medical field. If the controlled substance is abused, he says people won't overdose, but ketamine will increase the body's reactivity.
And with ketamine increasing reactivity in a young, healthy patient, a small amount of stimulus like that can create a potentially life-threatening condition called a laryngospasm. The throat can close and you suffocate. It takes a lot to hurt yourself with ketamine.
An autopsy showed the amount of ketamine in Perry's system had reached a level used for general anesthesia. Miller believes ketamine deaths were not common until COVID, which led to less restrictions on many controlled substances, allowing companies to send prescriptions in the mail, increasing addiction to the drug.
And so this more is better mentality is driving a lot of the injury that we see out there. And we've had people in Chattanooga, the Chattanooga area, that have died from this take-home ketamine type approach.
Miller is concerned about some medical providers prioritizing profit over patient safety.
But just like these physicians that got Matthew Perry this drug, it's like they don't care. They're trying to make money. Like, they don't care if you get better. If they were trying to get you better, then they would do this in an ethical way that actually produces results.
To Miller, Perry's death shows the urgent need to adopt and enforce the minimum standards of care that were developed for ketamine infusion centers. Reporting in Chattanooga, I'm Riley Nagel, Local 3 News.
Of the 5 arrested in connection to Perry's death, investigators believe the 2 doctors were working together. The indictment says the doctors prescribed the ketamine without a legitimate medical purpose. Perry's assistant, another person, and a drug supplier called the Ketamine Queen were also arrested.